All right. Good evening, everybody. Let's swap over to the chat box. All right. Um, so back offshore again. So if we start to have any troubles with the chat or anything, please let me know. Our voice. They did a lot of internet working issues out here, so we're back to moving like we're supposed to be doing. Um, so tonight, as you can see, is toxicology. It's a lot. It is pretty in depth in here. There are added some more slides in here. There's a couple of things that I've added and changed to red. So if you see the red, um, I'll just say that they're pretty important. So I'm gonna let y'all make your own decision on what y'all want to do with those. But anyway, I'll get started. So, oh, imagine that. All right. So as an EMT, your primary goal is to ensure that your own safety and identify the possibility of a toxin exposure while preserving the patient's airway, breathing, and circulation. That is going to be your main function for this entire exposure of toxicology as we go through this class. So I want you to just remember what your primary goal is. If you don't recognize what exposure is there or what inhalation or any type of chemical was there, that's fine. Just identify that something was exposed, could be airway, could be a toxin or anything like that, and that their ABCs are preserved. That's the most important thing of your job tonight throughout this chapter. All right, so here's our normal fundamentals. We know these, so we're going to skip it. So toxicology is a recognition of management, carbon monoxide poisoning, nerve agent poisoning, and how and when to contact poison control. If you've never contact poison control, I'll go over that when it comes down to it. All right, so here's some of the topics we're going to touch tonight. We're going to do the anatophysiology assessment, management, inhaled, ingested, injected, absorbed poisons, along with alcohol intoxication and withdrawals. I'm sure, as you know, I will have the tongue twisting. I will start yawning shortly. It's always what happens, so I don't know what's up with that, but we'll be all right. All right, so let's see. So every day we come in contact with things that are always potential in poison. It can be just your bleach that you're cleaning house with. It can be the bleach and pine sol mixture that you make at home. That's a toxin, and those two don't go together. Just FYI. So almost any substance may be poisonous in certain circumstances. Different doses can turn every remedy into a poison. Like prime example, aspirin. So too much aspirin, you can have a toxicity to that. Too much will kill you. You talk about acute poisonings for 2 million people each year, and chronic poisons is more common. That's just kind of a little topic to start off with. We'll just kind of give you some theirs. So death caused by poisons are fairly rare. Rates of death have, as a result of poisoning in children, have decreased steadily since the 1960s. Those god awful resistant caps. Oh, sometimes I hate those. I'm sure y'all all get them, and you turn them upside down so you don't have to do that. And then you're like, crap! Now all my pills are everywhere because I knocked the top off. So we know it's a fail-safe system that affects us older ones. And then death caused by chronic poisoning in adults have been rising as a result to drug abuse. Well, we know that some drugs may be okay for you, but high quantities and quality ain't good for you. All right, so we're going to identify the patient of the poisoning here, where toxicology is the study of toxins, poisonous substances. We already talked about that. So, a poison in any substance whose chemical action can damage body structures or impair the function. Toxin is a poison substance produced by bacteria, animals, or plants that acts as a changing the normal metabolism of cells or destroying them. That's a lot. Toxins can have acute or chronic effects, so that means it can happen quick and it's be exposed, or it's going to take a while and it's going to be a chronic exposure over time. Substance abuse and the misuse of any substance can produce the desired effect. Uh, I don't know if you, but hey, Woo, you may want to check your mic. You loud, bro. Let me see if I can mute you too. There we go. Gotcha. Surprise. All right, so where are we at? Okay. A common complication of substance abuse is overdose when a patient takes too much toxins dose of a substance, and we see that a lot in EMS. I mean, it's our job to take care of people no matter what. But you got your chronic drug users. You've got your I hate to use this word, but chronic abusers of either spousal abuse. Um, mis- there's so much there, but you see a lot of it is in women or men that are abused in relationships, just want to end things, and they're going to take a lot of pills. Well, not all the time. A lot of the pills are going to do effects because they're going to take 30 sleep aids and call you to come get them. Well, that's where we come in there, and then they get all pissy because they got to drink all this charcoal and then throw up all in the back of your truck. So it's really fun as a provider to take care of those people like that. But over time, they continually to do that because what they're doing is they're reaching out for help. If you can't help them, they're trying to find that help because they're scared. They're scared to make that decision to end their life or anything like that. So that's why a lot of your overdoses are done that way. And it's just a reach. And if you can help them, do your best as a provider to reach out and help them. So again, right here, your primary responsibilities to the patient who has been poisoned is to recognize that a poison has occurred. For your own safety, you must pay attention to the surroundings, or you could also become exposed to substance at the same time. Well, that's what we've talked about. Know your scene. Know, always look around. And for a long time, as you getting into the field, you're gonna look around and be like, what's that? And then you'll ask questions of why this is there. But then, unfortunately, we all do it. We kind of get into a system. We kind of roll, and things we're gonna normally see, we're not gonna normally see over time. There's the yelling. So keep your eyes open. Make sure you pay attention to what's going on. Um, the where, what, and how the toxins exposure is very, very important, especially for our PCRs, our patient care, our treatments, our, you know, small, simple treatments that's easy for us. But if you suspect an ingestion or exposure to a toxic substance has occurred, notify med control and begin emergency treatment at once. So there's some things we can do in the field, and there's just some things we can't. Y'all know that. I mean, we are heroes, but at the same time is we're not laying hands and healing right there in the field. So if you recognize it and all it is basically carbon monoxide, pull them out to the open air, good. Travis, I was working the ER a few months ago and had a mom brought her 2-year-old child because she got in hold of her grandmother. Oh, Lord Almighty. So the grandmother's lisinopril. I'm sure that they did some pumping or some sucking out of the stomach. So, I mean, it's possible. Anything's possible with kids. Y'all know they get their hands on everything. So, keep that in the back of your mind when you go there and the parents are freaking out. Well, how do you know? Because this whole bottle is missing. So, that's a good one there. So, it says the signs and symptoms of poisons vary accordingly to the specific agent. Presence of injuries at the patient's mouth strongly suggests the ingestion, swallowing of a poison. I mean, they'll have redness around the mouth. Trevor says, "Oh yeah, charcoal all over the floor, bed, and walls." Oh, I don't know if y'all have ever done it, but I highly suggest it. Just dab your finger on that charcoal and taste it. Oh, can't do it. I did it. I've been there, done that one. But just to let you know, it it is not good. So when you're trying to cram this down somebody's throat, just remember it's not good. So now, come on, cuz you need to try it. It's worth it one time, so you know you'll be like, no, But most of the time, they uh they can't really taste or smell. I mean, taste that's going down because they're in the state of mind or the medicine's kicking in. So here's a huge chart. Um, the table that shows signs and symptoms of some of your specific types of poison overdoses. So we go. I gotta remember which mouse to use. So talked about down here with all of our sludge. That's very important. Remember your sludge when it comes to neurologic and chemicals and any type of roadway hazards, um, military radiation, anything like that. The sludge is the very most important to document things. So anticoagulant coagulants examples: atropine, diphenhydramine. So all of these right here will give you some of these signs and symptoms. It's really cool. They break it down. You may see some of your tachycardia and same thing as your sympathomatics. But just documenting what you find, how you see it, it's up to the hospital and the labs and all that to pull the drug. I mean, pull labs and blood to get them treated and all that. So it's just easy for us to recognize it. Most of the time, if we know, we'll give them charcoal. Other than that, we're just going to protect their ABCs and we'll get them to the hospital. I told y'all. This yawning starts. All right, so here we go. If possible, ask the patient, what substance did you take? When did you take it? How much did you ingest? In just a few minutes, I'll make sure to turn that off, I promise. And did you have anything to eat or drink before? The reason why we want to know about the having anything to drink before is anything that's on the stomach. Is there anything basically between the stomach and the overdose or the poisoning itself? Has anyone ever given you antidote or substance orally since you ingested it? And how much do you weigh? Yeah, we ain't just gonna have to get personal. Some folks don't want to know. I mean, we guess a lot of weights a lot of times because as medics, a lot of our drugs go off kilograms. So, I mean, if I may guess low, I may guess high, but most time I guess high. I guess I'm just not nice when it comes to that. So here's some of the things. So try to determine the nature of the poisoning. Look around the immediate area for an overturned bottle, needles or syringes. You got some scattered pills. Now you may see chemical bottles or something on the floor, remains of food or drink on the items. You may even have an overturned plant. Now instantly y'all think about some weed plant. Come on, it's all right. I know we all like it, but we're not talking about that right now. Some plants that are in your home are also toxins, are toxic, and we don't know it. We just because we're like, oh look, that's pretty, I want it. Well, it's cool, but sometimes it's not good for us. Place any suspicious materials in a plastic bag and take it with you. So I'm just gonna say that one of our poison control doctors in Jackson area always wanted you to bring stuff. Always. Well, unbeknown to us, that one time we had a snake that poinsettias are toxic. Yep, good job, Victoria. Thank you. And they'll also kill an animal in a heartbeat. So this guy got bit by a snake. Man, I despise snakes. Not scared of too many things or too many people, but I'm gonna tell you, me and you we don't talk about snakes. I don't like them. So this guy got bit by a snake. He cut the head off. Well, me being my smart ass stuff, I threw the snake and the head in a bag and took it to the hospital. Because that's what the doctor always wants. He wants to see what it is. Well, he was scared of snakes. And when he comes in and starts being a turd and asking this and asking that, I threw that sun gun on the table. In the bag now. He didn't ask me to bring nothing else anymore. Some of the containers at the scene can provide critical information, such as if they can't, look for on the bottle or the pill or anything like that, may have a name and what concentration of the drug. So if it's a liquid or it may say 200 milligrams to 500 milligrams, that's what I mean by the concentration of the drug. So you may look for ingredients and originally, so if you get a pill bottle, look at your fill date versus what the date physically is. So if the bottle was filled on the 1st, today is the 9th, and there's a 30-day supply, technically there should be 21 pills left. So the number of pills in the original bottle will give you an idea, plus the fill date. Now, granted, sometimes some people may add 2 months worth in one bottle. Those are the things that you just got to pay attention for and just use common sense. And then you'll have the name of the manufacturer, I'm not going to, unless it comes from a pharmacy. If it comes off the shelf, maybe. And then if it's a pharmacy, it'll tell you the exact prescribed dose. Mickey, most meds when expired become toxic. Yes and no. And yes, you are correct because over time they build up, they sit there. We don't really know what the exact strength is because some got a little dusty on there, or Victoria says, or they put them in a weekly met. Now that's correct. So, but back to Mickey when you're pointing about that. So yes, if they start breaking down and they get powdery, they can become, because it could be a 200 milligram with some extra added. It's yes and no, and I'll agree with you because, and then you have some people that like to keep their medications for like 7 years and like, oh, I can use that antibiotic next time I get this toothache. You ain't got no more teeth, ma'am. So I don't know what you do with taking this. And then there's also things like Victoria pointed out about putting them in the pill meds. I do that, but I take a lot of natural medicines, like OTCs. I only have one prescription in mind, but I am very anti the weekly med box and daily med box for that reason. I don't tell the patient that they shouldn't ever do that unless they're of age. I guess that's the easiest way to put it, is the age may draw concern to that. So very good points for both of y'all. Thank y'all so much for pointing that out. I know I got sidetracked there, so I'm sorry. If the patient vomits, I don't do vomit, y'all. I don't do that. So even if I'm suctioning it out, no, cause I'm not gonna be looking for no pill frac. No, not happening. Sorry. But I will tell y'all, if y'all want to, feel free. Y'all might as well go ahead. And then I don't know why it's gotta tell me to tell y'all to wear proper personal protective equipment. No, I'm waving my finger. Not doing it. Note and document anything unusual that you see. An overdosed patient that's vomiting. That's not normal. I don't know. They won't let me put that in report and close it. But use your common sense. Things look iffy, and just don't sit right with you. Document it. If you need PD there, back out, call for help. Be like, hey, Victoria, I need your help. I need your help getting the red stretcher out. And so both of you know that it's time to go because you don't feel comfortable or something is bothering you. Travis says, guess I'm the weird one because I was examining that baby all day long. No, not. I don't do that. That's one thing I've said 20 years of being a paramedic. If you get sick and you vomit in my truck, I'm not giving you no medicine because I got all the medicine in the world to make you feel better. But you won't tell me you sick and you getting that? I'll make you hold your own vomit bag too. So, all right. So, how do poisons enter the body? So, this is kind of gets a little bit more depth. So, emergency care for patients who have been poisoned may include actions that range from reassuring an anxious parent to performing CPR, which we know that's kind of common. Some drugs are going to do different things, and sometimes they're going to stop them right then and there. Most often, you will not be administering a specific antidote because most poisons don't have one. The medication antidote most commonly available in pre-hospital providers is Narcan, which is used to reverse the effects of an opioid. Now, not all Narcan is not a telltale drug just because you don't know what it is, but it's not going to be hurt to be given. So if you give it to somebody and they don't come out of it, well, guess what? It wasn't. It wasn't an opioid. So remember that. Then defined treatment can only be provided. Definitive treatment can only be provided at the ER. So transport promptly, because y'all know we've all talked about it, stay and play or run and go. Well, we can't fix some things, so let's not stay there and see what's going on. The most important treatment you can provide is diluting and/or physically removing the poison agent. Yeah, I mean, unless it's like unless you can brush it off or wash it off, or and that's talking about diluting or removing. I think brushing and dilutions about copious amounts of water is about basically the only thing. And I mean, Dilution is the solution when it comes to firefighter. When they teach, chemistry to hazmat, basic A&O for hazmat. I've been through chemistry to hazmat, and it's pretty in depth. But I'm just gonna say that dilution is a solution until it's a certain agent, and then water is not good. So just sometimes it's nice to say, I don't know, I'm just a paramedic. I don't know what you're talking about, because I don't let people know my background. So we're going to talk about this. We'll go in a lot in depth on each one of them. So there's a reason why it's red. I'll let y'all make that decision. So how you provide treatment depends on how the poisons got into the body. Well, yes, true. So here's your 4 steps: inhalation, absorption, ingestion, injection. Now, absorption means surface contact, as in it touched you, you touched it, it's on your skin, like an extinguisher, a fire extinguisher. When you spray it, the crap gets all over you. Same thing. That's the absorption of the body. So we all know that. Stand by. All right. I'm the only one making noise, unfortunately. All right. So like a pain patch. Yes, absorption that way, correct. Now I have seen my wife's step ex mother-in-law. She chewed on 4 fentanyl patches, and she passed away. I know that's very ugly for me not to be remorse about it, but when you try to eat 4 of them, that is, I was just gonna say that's what you get. Anyway. But so yes, and you can chew pain patches. Just FYI, she attempted it, but I'm not gonna say you're gonna survive to tell the story. So if you don't understand what we're talking about here, here's our stages right here: inhalation, absorption, ingestion, and injection. I'm just trying to figure out what rubber cement. Y'all know we all smelt glue. Come on, y'all know that. Some of it you won't do it but once. You'll be like, oh, no, we good. Mm-mm. And I guess the old boy in the corner is trying to look like a clown. I don't know what he's trying to do, but and then I have to dissect this one. Can anybody tell me what's wrong with this picture right here? Take a guess. Anybody want to guess?
Well, that tourniquet's not very tight.
Yep, 100%. That's it. And I mean that's the right needle, so that's what caught me first. I was like, oh, okay. Well, he does have fluid in there too, but that right there. I mean, I know it's for the picture, so I know, but let's get it right. We got to use like a belt. I mean, like a shoestring, something that's real, but that belt is not tight. So I had to kind of giggle at that today. All right. So all 4 routes of poisoning can lead to serious and life-threatening conditions. Take care of and treat all patients appropriately. And the number one thing, keep yourself from harm. Period. No questions asked. Keep yourself from harm. If you are uncertain how to treat a patient who has been poisoned or exposed to a specific substance, find the container if possible, contact med control and the poison control center before you go on. I'll go further into poison control later. Again, like I said, I did it once. Just remember. All right, so inhaled poisons, they move into the patient into fresh air, CO2, carbon monoxide. Think about that. So that's the easiest treatment that you can do. Move them outside. If you can gain access to them. If you can't, don't take your butt in there. Stay outside. So then if the patient may require supplemental oxygen, and if they do, let's say even from a house fire, you're going to either try to potentially bag them and or a non-rebreather. Let's say they are just unresponsive and they are breathing. Just put them on that nasal can. Nasal can. That bag. The non-rebreather, and let them roll off that. 15 liters, good to go. Stand by. I see Rob's commenting on our Facebook page. I just want to make sure we didn't miss anything. Rob's saying go-to meetings is having some DNS issues on their end, and the website relies on it to get students into the classroom. They're working it, but until the issue's resolved on their end, ARES website access won't work. Well, I at least got 12 of y'all in here, so we know we're working somehow or another, but Rob's on top of it. I'm proud. All right, so back to this. So if you suspect the presence of a toxin gas, we know that. I don't expect y'all to even try to hold your breath and run up in there. Stand by. Let me go turn that off. I don't want to hear that, just like y'all don't want to hear it. All right. So if you got to remove the patient to the outside or wait on the hazmat team, come on. Fire department will get there. Most time those are hazmat guys on the trucks, and they'll take care of it. So a self-contained breathing apparatus is necessary to protect yourself from poisons. Most EMS providers are not trained to that level. I understand that several firemen are in this class. Great. Thank you for your career and moving on and how we do it. And also law enforcement. But at the same time, just remember EMS does not have the training. And if you're playing EMS provider and not firefighter, you can't cross roles. Certain companies will not allow you, even though you have that training. So just be cautious, be prepared, and be safe. Uh-oh. Come on, computer. All right. So, some patients may need decon by the hazmat, and I mean just copious amounts of water. So it doesn't have to be just the hazmat team. The patient's clothing should be removed in the process because it's going to trap gases and powders and all that other crap that can be released exposing you to the substance. The patient may have the following signs and symptoms: burning eyes, sore throat, cough, chest pain, hoarseness, wheezing, respiratory distress, dizziness, confusion, headache, or stridor in severe cases. So when I say that, I talk about decon and you may have to remove the patient's clothing. Remember how you would want to be treated in this situation. Fire departments know how to do hazmat. Decon processes. They know how to do copious amounts, fire trucks, ladder trucks, all that stuff. But at the same time is make sure you got plenty of sheets or coverings or thermal blankets or something for them to put on. Hell, we all just went through the snow. Can y'all imagine trying to be washed off and standing outside naked with just that on? So at the same time as you're going to want it, you need to plan this. If you can take time to plan this process, you can take time to plan for resources. So that being said, is think about that as you move on. So be prepared to use supplemental oxygen, like we said, non-rebreather or BVM. Pulse oxes are very important during this time because it may help you with that little telltale tool that you can pass around to check on their pulse ox. And make sure the suction unit is available because if they start vomiting, if we're outside, I'm just letting them vomit on their own. I don't want to mess with it. And then it says, as a rule of thumb, the fastest route is inhalation. So I'll let y'all hear that knocking about the one in red. So there's a reason why it's in red. Just my opinion. Just letting y'all know. All right. Some patients use inhaled poisons to commit suicide in a vehicle. We've known that. We've seen that on the TV. So it's kind of cool about that, how they do it, because they plan it. And you think if they're in that state of mind that they can plan it and follow through with it, you got to think they've really meant to. That's the reason why I say it's kind of cool, because they stayed in that mindset and they didn't want somebody to find them because they've met that, and the process is very unfortunate, but things happen. Um, we know how that happens. They leave the car engine running in like in a garage. They may put a water hose over the tailpipe, run it into the car. They may just roll down the windows in the car, and once they get those high levels of carbon monoxide, it's done. They'll lose consciousness and eventually they'll stop breathing. Um, Recent variation involves using chemicals or detergent in a tightly sealed vehicle as a type of gas chamber. Um, I don't know about that one, so I'm just gonna let that one. And it's obviously right there. It says when you open the door, you may be overcome. Some people have put notes on the car doors that are out in public, say don't open this. There's such and such in here. It will kill you, as they've been died. And the reason why they want to do that in public is so that they can be found. They want to be buried. maybe trying to get somebody to feel just as bad as them because now that they are being missed. And so there's so many different things to think about that. And obviously we're going to want the fire department, police, and all of those badges and numbers and abbreviation people there. Um, Absorbed and surface uh, contact poisons. So, absorbed and surface contact poisons can affect the patient in many ways. It can either get through the skin, the mucous membrane, or even eye damage. Chemical burns, rashes, or lesions. Systemic effects. It is important to distinguish between contact burns and contact absorption. So, the reason why they're saying that is if it's a contact burn, you're gonna have the redness around the skin. You'll have maybe like a circle of where it was at because it was a contact burn. Now, contact absorption, the reason why they want you to tell the difference because the absorption, you might be able to wipe it off, you might be able to dust it off, but remember if you dust it off, it's now in the air, so it could be a respiratory issue. So, and the reason why they say is determined between which two is you want to know how it's going to affect the body. So once it affects the body, you know which one's going to be faster. Um, and plus you have to treat them differently. That's why they want you to distinguish between the two. So here are signs and symptoms. We showed you on the sheet too. You'll see a lot of these again. Liquid or powder on a patient's skin. We talked about that. If you can wipe that off, be very good to wipe it off. And most of the time, if you respond to any of these incidents on one unit, that unit is going to be depleted of every freaking thing that's on the truck. And when you go back, you're just like, I need a little bit of everything because you're going to use ABD pads, you're going to use 4x4s. I've used tape and large rolls of it to tape and pull the chemical off the patient's skin. I've used bed sheets. I've used, oh, you name it, everything. So you just go back and you're like, I need a new truck because this one's destroyed. So, so emergency treatments. So the biggest thing there is just avoid contaminating yourself. We know that because we keep telling you to take care of yourself. If you don't take care of yourself and you contaminate yourself, who the hell is going to take care of you? I mean, we're just waiting because nobody. While protecting yourself, remove the substance from the patients as rapidly as possible and as safely as possible. Remove all contaminated clothing. Don't. So here's the thing: is unless it's a life-saving issue for that patient, like it's burning them, or if you don't have nothing to put on that patient, you may can delay that just a few minutes. Now, if it's a life-saving, shuck them drawers, boys. It's cold out here. Same thing as ladies. You may have to separate them on one side of the unit versus the other. Don't want to intermingle them. Um, you're not gonna have enough water on your truck to flush the skin thoroughly. If it's for multiple people, maybe for one or two people, you may have enough sterile water bottles in the back, and you may also be able to poke some holes in an IV bag with normal saline and start to try to flush it out that way. It just depends. Depends on what your agency requires and or your state requires you to hold. Sorry, don't know why I'm yawning. I think it's day one back on the rig. So if a dry powder has been spilled and you can brush it off, brush it off. But make sure you check the wind first. If you're upwind, uphill, fine. Downhill, downwind, don't do it, bruh. You're the next patient. Then it says flood the area with water for 15 or 20 minutes only if you know that it's water soluble. If it's not water soluble, don't do it. It will cause more issues. Victoria, call the tanker truck, hose them down. So there's ways. Yeah, I'm not gonna say just hose them because that may. I mean, it could remove the chemical and some skin, but there are ways that the fire truck can do it, and the fire department's always willing to want to do something because they practice and they don't ever get to do it. Trust me, I've done it like twice in my whole career. Um, so if, like I said, right there, 15, 20 minutes again on the skin, only if you know that it's water soluble and you can do it that way, do it that way. Here's a little cool trick on doing the, sorry, I was checking what time it was. Nasal cannula. If you'll look, that's what they're doing. They're flushing the eyes. Um, you want to wash them, irrigate them as fast and quickly as thoroughly as possible. And they're gonna fight you. It's probably gonna be burning. Their eyes are obviously covered in water. There's multiple things there that I see that this patient's gonna be doing to you or saying to you. But remember, just there's ways. If I'm sure one of your friends at the EMS, or if you've done it before, can show you how to hook up a nasal cannula to an IV bag for an eye flush, and you don't have to fill up 10 cc syringes all the time and try to flush it through there. It's not the easiest thing in the world, but once you get it working and you figure it out, you're like, man, this thing's pretty cool. I should have known that a long time ago. I hope you never have to use it. Let's see here. Some chemical burns may occur in industrial settings. So if you have an industrial plant in your area, hopefully your FTOs or your community outreach person for your EMS provider have reached out to these plants, facilities that store these products, because they're called MSDSs, and they're supposed to have those on hand, which provides you information on how to treat them if this substance on them. And if there's a safety officer on scene, most of the time that plant is going to provide you that no matter what, because that should be your first thing: is what chemical is this, and where is the treatment plan for it? Because that's what an MSDS does. It tells you what's going on and it gives you the first aid. If I'd have thought about that, I'd have pulled one of the chemicals that we have out here as an acid. We have an MSDS, and I'd have scanned and put it on here. It says there, ensure you, your team members, and the exposed patients are thoroughly deconned. Um, and it may be good for you to report back to your station after this is over to change clothes, wash your clothes, and then wash the I would at least wash them twice, and then wash the wash machine out a couple of washes of just nothing in it. There it says right there, attain the MSDS, and that's what it is, material safety data sheet. Whoops, there's my cursor right down there. And if not immediately available, have the company fax it to the hospital. And I don't even go that far. I make them say, hey, you need to bring this to the hospital. What's your cell phone, so I can tell them that you're coming with it if they have any questions. Because those MSDSs will help out a toxicologist when it comes down to it on how to. It tells so much stuff in there if you've never looked at one. That's the reason why MSDSs are important. All right, so ingested poisons, about 80% of the poisons are by mouth. Y'all can figure out why right there. Uh, Liquids, household cleaners, contaminated food, plants, and drugs. We've talked about it a little bit just in our chats over here. So y'all, I mean, it's common sense. I don't want to put it any worse, but it's, y'all know, contaminated food. You're like, oh, that just don't taste right. Maybe the liquid that you're cleaning with, household cleaners, plants. Somebody put something in your drink. It's the reason why the liquids are there. Drugs. So it's either recreational or pharmaceutical. So y'all get it. Y'all understand a little bit. So usually accidental in children and delivered in adults. Yeah, y'all know that. Y'all know why. Let's see. Travis, you talked about that a while ago for accidental in children because of the grandparents' medications. Um, Deliberate in adults because stupidity, and I don't mean that disrespectful to if they're in that state of mind, or an incident like Victoria said where they put them in the weekly pill bottles and they're like, oh, did I really take Tuesday? I don't know. Let me take another nitro. Well, that's an overdose. And now that's the reason why they're in cardiac arrest. It was an accident, but now it's turned into a fatal accident. Signs and symptoms, it really depends. Each one's going to show you, like I showed you a while ago on that chart. They all depend differently on what it is. But some of them include burns around the mouth, gastrointestinal pain, vomiting, cardiac dysrhythmia, and seizures. Seizures are going to be your worst because it's neurological. Y'all know that's coming. So if you see seizures in there, it's going to be pretty serious. It's going to be a fast exposure. So just kind of ponder and think on that. Treat signs and symptoms. So I teach this not only for you guys, but I tell new medics that come out to the streets and basically anybody that kind of gets on my truck. Those monitors that we have, $50,000, $60,000 monitors, are great. But ultimately, once you get what you need off of it, turn it off. Like perfect me, I turn it off, leave everything in place. I treat my patient, not my monitor. So you want to treat what you see and what that patient's telling you versus what the monitor's saying that they're in tachycardia. Well, if the patient is just hysteric, that's why. Don't just try to, lay them down, put their legs in, Trendelenburg position because they're in shock. Well, probably because of the situation. So just remember that. Treat your patient, not your monitor. That'll come in play later. Consider whether the unabsorbed poison remain in the gastrointestinal tract and whether you can safely and effectively prevent its absorption. So, as a rule, the slowest is ingestion. However, depending upon the substance, any of these routes can cause serious harm. Y'all get that, I hope. So, just because it's slow for absorption into the body, don't mean it can't kill them. Because maybe they waited 4 hours to call you because somebody found them, and now it's only 30-minute transport time, but that's their body's starting to shut down because it has affected them too far in that area. So for some of you folks that don't know, here is your charcoal. Some of your agencies allow y'all as EMTs to do that. So right here, this is like a little. You can cut these off at angles. You can also pull the cap off and chug it like a normal. But I will tell you, over years of experience, cut this off in sections. Don't just start at the small hole. Cut probably about here up in an angle, and you provide it to the patient. Don't let them say, "Oh, I'm gonna drink it." No, you're not. Open your mouth, pour enough in there that they're not gonna choke. Because when they start choking and spit, it's gonna be all in the back of your truck. Well, guess who has to clean that up? You. So cut it open at times. Sometimes it may get clogged, and that's why you don't want to. You can cut a little bit more or poke a hole in it, but the more you're poking and all up in here, just remember you only got so much to cut. So where you start cutting is up to you. All right. So injected poisons. Exposure by injection includes IV drugs, environmental by insects, and arachnids and reptiles. Injected poisons are usually absorbed quickly into the body and cause intense local destruction. They cannot be diluted or removed from the body in the field, and the patient's condition can be life-threatening and most likely act quickly. Well, we know about the bee stings, we know about the animals. A snake, that's going to be dangerous in itself. I'll probably have hurt myself worse than a snake is. But we know it's an injection. It's gonna get, and we know even when you go to the doctor, if you get an injection, because you're like, oh, I feel like crap, and let me just give me that Rocephin shot and let me just work it out, because we know that injection is way faster, and that's the reason why we want it injected because we want to feel better soon. I say sooner, which I know that's not correct, but so remember, if it's injected, it's gonna be fast. So if they injected the drug overdose, it's gonna be quick. And it may be one of those that your Narcan ain't gonna work just because of the situation. All right, so here's some of your signs and symptoms. Imagine that. We've seen those again already. Weakness, dizziness, fever, chills, unresponsiveness. All those, we're gonna see that. We've seen them probably in the last two issues. Monitor the airway. Imagine that. That's your primary job, is to keep their ABCs functioning. There it is. Airway, high flow O2, and be alert for nausea and vomiting. I'm just gonna give them a bag and say don't miss. If they start to miss, then we're gonna have issues. So the reason why we want to Obviously, remove rings, watches, and bracelets from the area, around the areas because of swelling, snake bites, animal bites, bee stings, anything like that that will keep from impeding circulation. If for some odd reason the ring is on there and we have to cut it off, it is what it is. But if we were able to remove it earlier, maybe we should have removed it earlier to help that patient out a little bit. So here's some of the things that they want you to pre-think about. Scene size up. We know our dispatchers can only do so much. They're only given so much information. At the same time as I don't know if anybody. I mean, I know Victoria, but I don't know if anybody else in here has ever been on the dispatch side. But you gotta answer the call, get the officers en route, get the fire department en route, then transfer over to the ambulance service. So where they medically dispatch the call and they ask so many questions that that person that's on the phone just may not know. I don't know. Maybe I shouldn't have called y'all because you asking a lot of personal questions. I just need an ambulance and the police. So remember that. If the dispatcher can't give you the information, it's because they ain't got it. I harp on that because my wife was an ex-dispatcher, so I kind of got fussed at many times on the road as a deputy about asking questions when I knew she didn't have the answer. So ask is there an odor? What do you see from outside? Is the scene safe? Um, what do I see from at least the door? Do I even feel comfortable going in there? If for some odd reason it's low light and you're like, we've had a lot of meth houses here lately, which we don't have anymore much anymore, but do you see a lot of cigarette butts and beer bottles packed up around the outside? Well, that tells you that they're a smoker. Oops, wrong one. A smoker, and they drink a lot. So potentially syringes outside. Keep your hand, like I always like to keep my hands in my pocket. Drug paraphernalia at the scene. Do you smell drug paraphernalia? Or it says at the bottom, do you indicate presence of a drug laboratory? I mean, we're not in Mexico where the big ones are, but I mean, shake and bakes for meth. That's very common. It's easier to have those than it is a true a drug cycle. So when I say ask yourself those questions, and I know we're just beginning, and you're like, well, I don't really know what to ask myself. Would you allow yourself and your child, or a child of may not be yours, to go in to this scene? If you say no, what the hell are you doing in there? So just when I say use common sense, it's maybe because you don't know, but at the same time is, does it look safe? If it's not safe, then why are you trying to go in there? Call for extra resources, backup. It doesn't necessarily have to be another unit, but just call for some help. And I mean, don't get on the radio and say, help, I need it all, because the cavalry is coming, people. Fair warning. People from the woodworks is coming, and you be like, I didn't even know we had them agents in the area. So remember that. So determine the severity of the patient's condition. Is it a load and go? Is it a stay and play? Can I fix this? Oh, well, look, if I just pull this guy out of the garage, so he's working on his car and left it running, will it fix the problem? Yeah, maybe because he's stupid, you can't fix that. Is there anything immediately that I need to fix? The life threats. Is that something I need to, can I handle it right now? And don't just assume that it's conscious, alert, and oriented patients are in a stable condition. They may have a TBI. They could be under the influence. I could keep going on and guessing for hours. But don't just assume. Just because they're able to answer your questions and all that in a couple of seconds, they may not be at all. While you've walked off to get your tablet out of the truck so you can start your refusal, this patient may turn south, and now you ain't got no equipment standing there, and you're like, man, bro, this dude just coded, and now I gotta go back to the truck and get all my crap. Dude. So, yeah, we've all seen it happen, and that it can burn you. I just kind of give y'all some real life education at the same time. All right, so airway and breathing. We harp this. Is it open? Is it patent? Do they need extra support? Do they need high flow O2? Do they need an adjunct? What what do we got to do to it to keep their airway open? Okay, is it suction out vomit? Is there something that's blocking the airway that I can remove and or can I not see? If you got to assist with ventilations because of some substance act as depressants, you may have to turn around and bag this person. Uh, assess the skin and skin conditions for a pulse. You will find variation depending on the substance involved. You may have tachycardia. You may have bradycardia, where you're like, man, I think I feel something. Well, a good thing, if you have a portable CO2 detector or pulse ox, they give pulses too. So you can put that on and work on something else and be like, oh, he is only beating it like 22 times a minute. So maybe I need to keep my stuff out here. So use your tools, but at the same time, be smart about it. Um, if their ABCs are not opened, that's your job to fix that. If you can't fix it, make sure you document it, because if something's delayed, you have to document that. If you did something but didn't document it, when you go to court, if you go to court, it didn't happen. Well, sir, we did this on this and this. Well, it didn't write it here. So you just saying that, as you can tell, I've been to court multiple times. So they're going to come after you for that. So all these things in your head, you're going to be like, man, I just wear a tape recorder or one of those police cameras so I can remember it all. Well, you kind of can't, because it goes against HIPAA and all that fun stuff. So remember that when you go through these things, it's a lot of familiarization and how do I do this? How do I do that? But these three things right here, ABCs, is your most important job on this entire lecture. All right, so our transport decisions. Are we just going to run them over to the closest Band-Aid station? They may not be appropriate for that. They may not have the right crap at all to treat these patients, so why would I take them there? I just don't think that it's appropriate if you transport them also 45 minutes down the road, because that's where family wanted them to go. I don't really care. I'm the provider. I make the best decision for this patient at this time. So be smart about your transport decisions. And if it's a big enough scene and you're going to have hazmat everywhere or all over the area, and it may be a good idea to call the hospital and be like, hey, this is what we got going on. Can you tell me what's going on? So they may tell you, hey, when you're done, when this patient needs to come here, this patient needs to go there. They may help you with that. They may give you some ideas. So be on the front going about that. As if you recognize multiple patients and you have multiple resources in there, call your local trauma center. Sometimes I'll speak highly for Mississippi. We have a MedCom. It's called Mississippi MedCom. They manage, they help manage the bed boards all across the state of Mississippi. That goes from normal hospital open beds to taken beds to ICU to all the different ICUs, along with helicopters. I mean, they do it all, and they also help with triage of a large scale incident on what patient goes where, and they keep track of it. All their radios, they can talk to anybody in the state on a radio on a state owned system, and it's all recorded. So if it all comes down to it, that radio report can be, pulled and gone to court too. So I say it's helpful at the same time, but just think about that system, that if you got something big going on, it may benefit you to reach out. Let's see here. All right. So we'll talk about the history taken. We know that. We've done this before. So what is their chief complaint? Is your patient responsive? Are they beginning evaluation of exposure to, and you get the sample history. If the patient's unresponsive, and attempt to obtain history from other resources, coworkers, bystanders, friends, family, all those people that are around waving Willie, and you start asking questions and they don't know, guess what? They will leave. I promise you. Dig in this person's belongings in their wallet. Go through their stuff. Maybe they have it written down. Be like, I'm allergic to blueberries, and they ate blueberries at lunch. Well, if you got something, you might be able to fix that, or it's called an airway adjunct. So things like that that may just be written down for you. You just gotta look. Obviously, we wouldn't want to spur their stuff everywhere, so we just kind of we can just pile all their crap we pulled out of their purse back at one place and put it back in there. So, and I don't want to say just that gives you opportunity to go through somebody's residence, but they called you to take care of them, and now you got to figure out what's going on. So sample history, it just sample history guides you on what to focus on as you go to continue to assess the patient's complaints. The physical examination and vital signs tells you what is happening to the patient's body. In addition, the sample history asks the following questions: what substance was involved? When did the patient ingest or become exposed to the substance? That may be something dispatch can also get and find out prior to arrival. And then how much? What quantity were they exposed to? Uh, that'll be helpful in the long run. Probably not to us initially, but the long run will be there. So questions: over what period did the patient take the medications or were they exposed to? I want to know how long. Has the patient or bystander performed any intervention? Did they try to dust it off? Did they put a fan in their face? Did they get oxygen? Have they taken any other medications? And did it help? That reason it's important to us because we don't want to have to potentially expose them to something else, trying to treat them on something we weren't aware on their dosage. And then again, how much did the patient weigh? Because the antidotes, majority of the time, are given off of weight. We'll talk about this and then we'll take a break. So your secondary assessments, this is going to be mostly important because a lot of times your patients aren't going to be doing good. They at this point you're probably like, oh crap, why did I work today? I knew I shouldn't have done it. You're probably beating on yourself, but you're going to constantly want to check these patients. Check their LOC. We see their pulse rate, just vital signs. Keep up on that. Some poisons produce an outward indication of the seriousness of the exposure. So uh, alterations in the level of consciousness, pulse, respiration, blood pressure, and skin are the most sensitive indicators that something is seriously wrong. So if they become flushed or their skin super palely white, well, maybe just because we're all coming out of winter and quarantine, that's not the reason. But so keep those things in there, and then check if the ABCs have been addressed and you manage that in the primary assessment, thoroughly examine it again on your secondary assessment, and that may help you if there's any secondary exposure or documentations. Hey, open the airway, provided 15 liters. Patient's O2 sats rise to the 98. Patient stated that the mask was hurting their face. When I removed the mask, I noticed red whelps underneath the non-rebreather. Well, that's important because now it seems like maybe that toxin may still be on the skin, unseeable, but the mask created some sweat and some water, and that may be what it's reacting to. And then you focus on the area of the body involved with the poisons or the route of exposure. So I try to tell y'all to document. I know y'all are like, I don't know what all to document and what not. Yes, to all of it. Yes, that's the best I can tell you. It's just document it all. Your first report's gonna take you forever, ever. I have 7 o'clock on my end. I think y'all probably have it on your end too. So let's take 10 minutes, and I will see you at 10 after 7. I'll see y'all back in just a few minutes. All right, everybody back? Like y'all are gonna say yes or not. All right, so we'll go to reassessment. So we talked about reassessment. We kind of know in our secondary assessments, um, check your ABCs, check your vital signs, repeat your 5 to 10 minutes. Critical, non-critical. Here it's saying 15 minutes. 5 minutes on a harmful, lethal dose. Majority of the time, that's going to go by pretty quick because you're going to be like, hurry up and get me to the hospital. So we know that's going to happen. Be like, why aren't you going faster? Hello? Because you're going to freak out. Majority, and all of us do. I'm not just saying, I'm not just excluding me from that, but sometimes you're like, oh God, I don't know what to do. Just give a bolus of diesel and let's go. So just reassess your patient. Make sure that you keep an eye on things. Uh, Double check your ABCs. Remember, fact I told y'all that in the beginning. It's your most important job. Anytime you have an I just went blank where I was going. I don't know. You call Med Control or the Poison Control Center. If you can dilute airborne exposures with oxygen, remove them from that. That's probably just as good. Remove them from the contaminant area if you can. If not, fire or hazmat can do that. If you're able to clear the areas with exposures with water, that's great. MSDS will also tell you if that material is water soluble or not. So kind of hint the MSDS because that's important. Consider activated charcoal for ingestions because what it does, it absorbs that ingestion and it blocks it out. They are going to vomit. I don't care what you say, and it is gross. It is. It gets everywhere. As Travis put in there earlier, it's going to get over everything. They can just say hello, and you'd be like, "Why in the heck is that on my ceiling of this ambulance?" So it is what it is. Just make sure, I highly say, wear some safety glasses, something because it goes everywhere. So that's the only thing we can do for ingestions, but just reassess. Right there. Report as much information as you can about the poison control to the hospital or the poison or chemical, sorry. If the poison or exposure occurred in a work setting, bring or have the company fax them. No, just have, they need to bring the MSDS. Like we already said that. I hate when I keep reading that. I should edit that entire slide. But have them bring that with them. That is important because that person can also answer questions if, like, how, when did this happen? Who was this? Who was that? Because this patient may not be able to later down the road. All right, so for emergency care, what are we going to do? We talked about this in the beginning. I'm not going to harp on the same safety because I did that a few minutes ago, and I think that's very, very important. But I do like how they say right here, perform an external decontamination, because you ain't going to do nothing if you decon them in the house. So that's important that they put that there, so I really like that. Um, Remove tablets or fragments of the patient out of the patient's mouth. Wash or brush the poison from the patient's skin. Treat. Focus on support. Um, so if you can't add water, if it's not water soluble and you have to brush it, make sure you're standing uphill, upwind from them, and you can use like a broom or a brush or floorboard brush, something that's not hard if you're going to swipe the skin, but just to kind of get the copious amounts of that exposure off. If you're unable to get it off really well, call for backup. Maybe the fire department or that industry has something that can help remove that. So that's important that we think about that on the beginning is sorry, is to figure out how do we need to remove this. If you can remove it by the least invasive, do it. Let's go. I think that's a perfect idea. Least invasive is the most appropriate. Um, you want to make sure you keep an eye on the airway. Provide oxygen if needed. Treat for shock. Some EMS systems allow EMTs to give charcoal by mouth. Know your local protocols. That's the most important. It's the best I can tell you there. Know your protocols, know your policy procedures, so you can do that. Activated charcoal binds to the specific toxins which are then carried out the body in the stool. The hospitals will also collect the stool to see what the levels of the toxin is. Activated charcoal is not indicated for patients who have ingested alkali poisons, cyanide, ethanol, iron, lithium, methanol, mineral acids, or organic solvents. Don't ask me for an example because I don't know. I mean, unless y'all can give some. I know they used to give lithium back in the day for some crazy folks, but not in that kind of dose. We all know what ethanol is. We know what methanol is. Mineral acids. How about we just keep going? So, who have a decreased LOC and cannot protect their airway? It's whose job to protect the airway? The ABCs. Come on. What is our job? Our main job? Travis, answer your question. So, alkali metals are extremely reactive to water, producing flammable hydrogen gas that can ignite spontaneously. It's also it also produces caustic hydroxide solution, sodium hydroxide, upon contact with water. It may be harmful if inhaled, ingested, or absorbed through the skin. So I'll give you a little tidbit bonus. Now that you hear that, can you tell me which car has alkali metals in it? Yes, it can make gas if it's introduced to fire and with water. Does anybody want to guess what vehicle has alkalis in it? Organic solvents or like paint varnishes, lacquers, adhesives. See, that's the reason why I talk to y'all. Y'all know these things. WW, hydrogen, electric cars. Y'all are getting on the right track. Volvo. I know Volvo's not really big anymore. I mean, I know they still make some great cars, but Volvo has a lot of alkali metal in them. Um, and when they do catch fire, they react heavy to water, so you have to use um, dry chem extinguishers or a foam that bonds to it. So, and Daryl, yes, I think a lot of the electric cars now are starting to get some of the alkali batteries in their cars. So I wouldn't doubt that they're going to be the same way. I'm sure we'll start to see a lot more electric car fires, and the firefighting side is going to end up changing to the way that what they carry and the quantity of extinguishers that they carry. Oh, oh, oh. I'm sorry, guys. I think I got on the wrong slide, so give me just a second. All right, there we go. Whoops. All right, so that we talked about if your policies, procedures, JW, those Germans and their crazy car. Yeah, yeah. I had to admit though, as much as I drive back and forth from South Louisiana, it sure would be nice to have one of them drive your own Teslas. So I get lazy. It's tiring, I promise you. If your agency allows you, you can give charcoal. If they don't, you need ALS provider. So you may want to notify ALS care prior to route. So that's important. Some common trade names are Instachar, Acidose, and Liquid Char. It's all the same thing. It's like we talked about on pharmacology. It just depends on who makes it. So normally your dose is 1 gram per kilogram of body weight. So if you want to break it down a little bit more, so you normally go 30 to 100 grams for adults and about 15 to 30 for a child. So that's really your biggest differences. But in a hurry, always just go off 1 gram per kilogram. So if the patient's 200 pounds, they're roughly 100 kilograms. Yeah, I'm sure it's a little bit closer than that, but it's always half. It's a little bit easier to figure out. So now I give 1 gram per kilogram, so I give 100 grams. See, that's the reason why it's just easy for easy math. I prefer easy math in the field, so just a little telltale. So take your patient's weight divided by 2.2 gives you kilograms. So if you just take half of it, and then 1 gram per kilogram of instant charcoal. and be prepared with a vomitus bag. So before you give the charcoal, attain approval from med control. If your agency allows you to do it, you can go ahead and provide it. If they don't, you can call and ask for orders, but make sure you get the doctor's name and that they gave you permission or non-permission and what their transport decisions were made. So here's if you've never used it. Shake the bottle up very well because it settles. It's it's thick. It's going to settle, and you want everything to mix up very well. And you may need to convince the patient to drink this, but never force it. I just tell them, hey, look, I need you to drink this. This is going to make you feel better. I don't tell them what's in it. Shake the container frequently to keep the medicine mixed up. So there may be some times that you may just need to put your finger over the end of it, shake it up some more. Record the time you start administering it. Now I'm not going to tell you to start and stop, because you're going to do that multiple times. But from the time you started giving it to the time that you stopped and the bottle was gone. If the patient refuses activated charcoal, document the refusal and how many times you attempted to get them to take it, and counsel the patient. And if the transport the patient for further evaluation. Maybe this patient has said, I don't like that stuff. I've taken it before. Jack, why have you taken it before? So there's obviously a reason, and there's obviously a trait that this person potentially has ingested it before, and that's going to be a problem for you as a provider. Some side effects are constipation and black stools. Think so, because it's charcoal. What is color is charcoal? Black. So we're not going to see this constipation and black stools. That's going to be long term, going to be given at the hospital. It's not my problem after that point. I don't really care. If the patient has ingested a poison that causes nausea, he or she may vomit after taking it. I've never not giving charcoal and somebody not vomit. So it seems like to me it happens all of the time. So just go ahead and get ready for them to vomit no matter what. Uh, the dose will have to be repeated, but we're not going to be with them that long. So just know that what time you gave it, what time you stopped, and just be like, look, we had to take a couple of breaks back and forth, but we finally got the whole bottle down. That's really all the hospital needs to know, and what they want to know is because it's going to help them with treatment and to tell them what time to give that second dose. So over time, a person who routinely misuses a substance may need increasing amounts of it to achieve the same results. We know that. It's drug abuse. Same thing. If a person's addicted, as they have overwhelming desire or need to continue using the substance at whatever cost, with a tendency to increase the dose. Well, you think what's going on there? Almost any substance can be abused. Well, we know what that is. We're talking about it. So, hang on one second. Let me send a message real quick. All right. So, we know that's the drug abuse also. The first time you take it, it's going to get you that high. The second time, it's not. You're going to steadily increase it to where, I don't know, drug like street recreational drugs, but they take 1 ounce of it, and now they're worked up to 30 ounces. You can tell they've been doing it for a while. So they're trying to increase it because their tolerance has gotten way off the charts. So they got to get that high. They're constantly chasing it. And that's where your overdose comes from. And your overdose is because the body's like, I've met my max. I'm done. I'm tapping out, bruh. And they stop. Um, Here's some importance of safety awareness and standards precautions cannot be overemphasized. No drug abusers have a fairly high incidence of serious and undiagnosed infections of HIV, hepatitis, uh, and just they could have AIDS, they could have everything. So sometimes these drug users, and I've dealt with some that I don't know, haven't known, they'll just straight up tell you once everybody kind of leaves, they're like, hey, before you start that IV, I just want to let you know I have HIV. And you're like, cool, it's no big deal. And thank you for letting me know. So I kind of give them the same respect as they give me. Uh, so that was, they may tell you that. If not, always wear the proper PPE depending on the call. If the call, if you need to wear a gown and all that fun stuff, then do it. If not, then that's appropriate to whatever protocols and decisions you make. I don't think it's going to be issues for me to make that decision for you. And I like this one. Expect the unexpected. Remember, the drug users, not the drug, can pose the greatest threat. They may not realize that you're there to help them. They may not realize that you're the answer for help. They're so used to chasing that high, chasing that drug, that they may get violent. They may or may not mean to, but guess what? That's the end results. So be prepared. Uh, just always have your guard up. So alcohol, many calls for service have connection to alcohol. 1 in 10 deaths among American working age United States can be attributed to just alcohol abuse. They have noticed during the quarantine that there has been a large uptake in alcohol. I can tell you, I know that personally, but they have also stated that several liquor stores have sold out. Your ABCs, your distribution points just didn't have it. You've had increasements of spousal abuse, child abuse, all these things because everybody's crowded in the house together. I get it. I completely understand. I'm not saying it's right or wrong, but we all understand why these things have been increased. We all probably had our own personal issues that we've dealt with this. Um, drugs, alcohol, prescriptions, it doesn't matter. At some point in time in our lives, we've probably all dealt with it personally or professionally, or we know somebody. So again, let's consider that when you go and talk to these people that they're human just like us. So let's not take it for granted that they people. Let's remember, give them your full assessment. Make sure you treat them head to toe, even if they're in police custody and they are under the influence and it is proven to be under the influence, that's fine. But treat that patient. Don't just do abandonment. We know alcohol is going to affect the liver, most likely. Chronic use, occasional use, it's going to have binge drinking. Binge can cause more damage than chronic because the binge and surrounding circumstances. So just remember those things that are going to, they, alcohol is, it's I again have lost my thought. I'm sorry. I'm trying to do multiple things here and that's not functioning. So we know alcohol is a powerful CNS depressant, decreases activity and excitement, induces sleep. In general, alcohol dulls the sense of awareness, slows reflexes, reduces reaction time. It may also cause aggressiveness, inappropriate behavior, and lack of coordination. I can speak. Yes, alcohol is bad. Oh, I don't know, JW. They say that it is, but in mass quantities, everything's bad for us. Um, so look for signs of head trauma, mental illness, toxic reactions, or uncontrolled diabetes. That I'm telling you, check your CBG when you get these patients. No matter what, it may just be a diabetic issue, and you're going to treat them as an alcoholic, and then you may be look like a fool. Severe acute alcohol ingestion may cause hypoglycemia because they may also not eat. They may drink instead of eating. So now that their sugar is starting to decline because they have not put any food in there, they think that the liquid food is going to fix them, and it's not. Assume that all intoxicated patients are experiencing a drug overdose and require a thorough examination by a physician. Always transport your patient. Alcohol increases the effects of many other drugs and is commonly taken with other substances. I'll agree to that. I think a lot of people use them kind of hand in hand. That's personal. I mean they're put in the book, so there's got to be a. I'm sure there's a study out there that we've paid for in some form or fashion to see if drug users use alcohol too. And a lot of people will use the alcohol because yes, it is cheaper than some of your street drugs. Yes, it is more available, so I can see that they're overusing the alcohol and the drugs combined. If a patient exhibits a serious CNS depression, you may must provide respiratory support. You may just have to hold their head and just put a non-rebreather on there and do a head tilt chin lift. Maybe what they need because they so intoxicated. Depression of the respiratory system can also cause emesis or vomiting, so be prepared. The vomit may lead to forceful or even bloody because large amounts of alcohol irritate the stomach. So that's where some of these folks may have stomach ulcers, and when they drink heavily, it causes the ulcers. Well, you knew that, but at the same time, that alcohol dependency that they suffer from, they don't really care that it's causing them to vomit blood and that they're sick for 4 or 5 days because of that. It don't matter because in 5 or 6 days from that incident, they're going to do it all over again because it's the alcohol dependency. Internal bleeding should also be considered if the patient appears to be in shock. Patients in alcohol withdrawal may experience frightening hallucinations or delirium treatments, and that's what we call DTs. Um, DTs are serious. They are treated um, heavily in our EMS world. Um, you'll start to see them starting around the holidays, certain times a year. Brings on more alcoholism than others. So just because the seasons change and all that doesn't mean that you're not gonna pick up a couple of more runs of alcohol. Cold weather is a big thing too, obviously, since we just come through that. Quarantine, picks that up too. So DTs are characterized by those following symptoms. These conditions may develop after a person stops drinking or when alcohol consumption levels are decreased suddenly. Provide prompt transport. Remember your ABCs because that is your primary job. And reassess the patient and provide necessary care and emotional support. Like I've told you before, I always put in my report provided comfort care because that just shows that you're providing some form of functionality that you're like, hey, I'm trying to treat this patient as a patient too. This patient is a person. What can I do for them to make things better? So provide that. Maybe you just need to let them cry it out for you. I'm not saying give you cried out on your shoulder. I don't want you to touch me, but just let them cry it out. I don't know why I drink. That's okay, man. Talk to me. What's up? Just be that person. When you go to give a report, I've done many a times. Uh, AW is one of their biggest ones that we used to transport in Jackson. I'd let him give his own report to the hospital. He knew them. We transported him like 19 times a day. He knew what to tell the hospitals we were doing. So I'm not saying that's the best idea. Trust me. I've been in trouble multiple times for that. Opioids. I'm sure everybody knows these. I'm not saying personally again, but we know about opioids. Opioids is a narcotic, is a drug that produces sleep or altered mental consciousness. An opioid is a type of narcotic medication used to relieve pain. We can get these in the hospital too. Sometimes you'll get opioids in the hospital that will kind of like morphine. An opiate is a substance of the opioid family and refers to natural non-synthetic opioids. Opioids are named for the opium in the poppy seed, which is codeine and morphine are derived. Now, I will tell you, poppy seed plants are beautiful. If you've never had the ability to see them, I'm just saying it's going to be kind of hard for you to see them unless you go to the Middle East, but they're really pretty. I will say I've actually walked through a field of them, to be honest. Hold on a second. Let's see here. Use code and follow that. Trying to follow. I want to. All right. So I'll just tell you again. They really pretty. Well, I couldn't touch them because we had to wear gloves on, but you could get high as all get out just walking through them. I'm just saying. I don't know how that happened though. All right. So here's a little chart of some opioids. Matter of fact, look at there, morphine. We've all at some point probably had Dilaudid, Oxycontin, codeine. My body's highly allergic to codeine. Heroin, not sure. All of us have had that at some time. We've dealt with fentanyl in the fields, but these are some opioids that you're probably used to seeing or dealing with in the EMS world that we get those, and we have to deal with them. Um, Next. All right, so prescription opioid drugs are most commonly abused in the United States. We know that. Their VA gives them out by like Kit Kats. I mean, they hand them out. They want you popping them like Tic Tacs walking down the road, man. The VA is something. Some people become physically dependent on the opioids, and I'm gonna tell you, they will take 15, 20 of them a day. Right there, it says the death rate from heroin overdoses tripled between 2010 and 2013, and they're saying up to 44,000 deaths were caused by prescription opioids. Um, so, and I want to say, if I remember correctly, the study that I read not too long ago, that Alabama is leading the nation in the most prescribed opioids in the country. I don't really know why, but that's just what they say. So, they're going off a study. These agents are CNS depressants and can cause severe respiratory distress, depression, and then cardiac arrest. Well, y'all read that again. Y'all can say why, because it's slowing things down, and then the respiratory drive is dropping. Then we know that our brain is doing this automatically on breathing. So our brain slows down, the functionality slows down. Okay, so then the respiratory tract starts slowing down. Well, guess what? Now they're deprived of respiratory actions. So guess what? They not breathing, they heart not functioning. So there's a problem. We gotta fix that. Well, now we're gonna get called to the cardiac arrest instead of the overdose because they not breathing. Um, So that's why we're going there for that. Tolerances developed quickly. You may notice that their 30 pills a day may now be going into people buying them because their dependence on are a lot higher and they need them. So some users may require massive doses to experience the same highs. We talked about that. So their 1, 2, 3 pills a day now is trying to go up to 10 or 12. These drugs can often cause nausea and vomiting and may lead to development of hypotensive, and they probably going to swell their extremities, lower extremities, especially their feet are going to be swelled up. Uh, Even if they walk a lot, it doesn't matter. They're just going to be able to hold a lot of water. But they're not going to be able to shed it. So that's where you'll notice that they'll hold the water. So seizures are very common here due to overdoses and whoa, sorry, trying to throw my screen around. My bad. So you may get called for the seizure that are secondary due to the opioid abuse. So that's something you'll have to be careful of. Is treat your seizure, but you're also going to be treating the overdose of the opioid. So one of your little signs you're going to see right here. Oh, where'd it go? Pinpoint pupils. Cyanotic with pinpoint pupils. That's going to let you know that's more of an opioid than just a regular issue that you're going into, because your seizure patients are going to have histories of it, or just your randomos that come in and go back and forth. But opioids will give you the cyanotic, the pinpoint pupils, because it's the opioid that's contracting everything. Yeah, well, I'm a little tired. This morning started at 3:45. Side note: hotel staff walked in the room at 3:45 because they thought somebody checked out while I was still in bed. My alarm didn't go off to 4:30, but yeah, it's been a long morning. So I'm not only tired, I'm hanging in. All right, so we know naloxone. That's Narcan. We've unfortunately dealt with that for a I guess, what, past 4 or 5 years. So we know that's kind of one of those things. You used to give it once in a blue moon. Now we're like, bruh, we're giving that stuff like candy out. We're giving it all the parades. Like everybody's like, oh, naloxone for you, naloxone for you. So it's one of those now. It's like, man, it's no big deal to give Narcan. It's no more fun. So some systems check your provider that you're going to be able to do that, but you need to know what your system allows, what your protocols say. You can only basics can only give it intranasally if they're allowed to give it. You have to have an atomizer that screws on a little thing that goes up in the nose. You can give it all in one nose, or you can split it 50-50. But my suggestion is titrate to effect. You don't want to slam it because that patient is fixing to come up and slam you. So remember that. Be cautious about that. That they get very volatile. Have PD near. Have the patient properly restrained prior to doing so. But I titrate to effect because once you get your butt whipped about once or twice, you're done. You'll learn how to do it right. Um, so you see right here, should be only used when the patient has agonal respirations or is apneic, because that way you can give it and then bag them, and it helps get the naloxone in there properly. So place airway OPA if required. I don't like putting an OPA when I'm fisting to give Narcan because now it becomes a choking tool. They can be gagging off of it, so be cautious of that. Says, well, we all know the whole country can give it. Lay people can give it. They can buy it at CVS. So I've heard that a lot of people are getting high and have uh, overdoses right outside your Walgreens and CVS's because they have it in stock all the time. Let's see right here on my notes. As the level of consciousness rise, the patient will react to the presence of the oropharyngeal airway, and you will have to prevent aspirations by removing it. I just don't like putting that in their mouth. So be very cautious about that if that's the route that you go or told to go. So let's talk about sedatives, hypotonic drugs. Barbiturates and benzos are easy to obtain and relatively cheap. I notice a lot of kids will go shopping in grandparents' um, drug cabinet because they like to keep them. They don't need them. They just keep them up there and they put them in there. These drugs are CNS depressants and alter level of consciousness with the similar effects of those of alcohol. The patient may appear drowsy, peaceful, or intoxicated. They're not going to be your fighters. They're not going to be the ones that are just like, hey, bro, I'm good. What's up? I'm chilling. Uh, you'll see that they'll just be laid back, and they may actually if they're drunk, but they don't have the smell of alcohol because those benzos have got them, or the barbiturates. I just keep saying benzos, but could be barbiturates too. So in general, these agents are taken by mouth. You can see some of these goofballs now crushing them up and snorting them. I'm not a big snorter. My nose bleeds all the time anyway. Like the dude called me a lie yesterday when I got COVID tested. He's like, "Oh, you're not gonna bleed." Well, I gushed blood for like 45 minutes. So I told you, listen to him. I don't know. I'm not snorting anything. I couldn't be a cocaine addict. Um, so they use alcohol and opioid at the same time to boost their effects. So they may turn around and they may use it as a chaser. Um, Occasionally, the capsules are suspended, are dissolved in water and then injected. Can't do that either. IV sedative hypotonic drugs quickly induce the tolerance, uh, so the person requires increasingly larger doses. These drugs may be given to people as a knockout drink or Mickey Finney. I've never heard of that. Mickey Finn to incapacitate them without their no. Oh, so that's a roofie. I got you now. Sorry, I've never heard the Mickey Finn. Generally, your treatment is to ensure airway is patent, assist ventilations, and provide prompt transport. So you may see this, let's say, in a club setting. Maybe find somebody that's been sedated or drugged and got caught, and they kind of left them there. So think about that. Depends on your settings. What may have some concerts come in town. Hey, I guess JW, I'm learning. Slip them a Mickey. I'm gonna jokingly say that to my wife, and that's not gonna go far. But anyway. So these agents are inhaled instead of ingested or injected. So inhalants, a lot of times you can see if they do like they huff paint, their mouth will be colored. So I don't know why, but they say gold gets you higher than the rest of them. Yeah, man, I don't know. I guess that's room. I don't know. I'm not gonna find out because I guess you'd say I'm kind of a scaredy cat. But they found like glue's got them. Like maybe that's why the dude was smelling glue earlier in the picture. Cleaning compounds, paint thinners, and lacquers. Oh god, that's a headache for me thinking about it. Sherry, it happened to me. I'm sorry to hear that, babe. And look at their finger and thumb. It would be gold. Yeah, yeah. So that maybe their fingers may be colored. I always jokingly think about the ones that are in New Orleans that they paint themselves, and I'm like, do they get high off of that, or how? I mean, like, I don't. Some explain that to me. I don't know. Um, Maybe just thinking too deep. I don't know. So these are commonly abused by teenagers because everybody knows, Mama, you got paint and all these and all these acetones and all this stuff in the garage. So they can complain of headaches all the time. The effective dose and the lethal dose are very close. So they don't know until it's too late. It's just bam, all right, he's dead. Uh, Victoria says being high isn't worth the massive headache. You right about that. I done got old. I get headaches too many all the time anyway. Um, Always use special care. If you happen to find these in a confined environment, remove them to a fresh air. Automatically just drag them out, carry them out. What you got to do, get them out of that environment, bring them into a fresh air environment so you can start providing plus and light conditions and all that. Uh, what's this say? Hydrocarbon solvents may make the heart hypersensitive to the patient's own adrenaline. All right, okay. Even the action of walking may cause fatal. All right, so don't let them walk. You just put them on stretcher. I'm cool with that. Use the stretcher to move the patient, give them oxygen, and transport them. Try to keep the patients from struggling with their exerting themselves. Sounds like they heart is just gonna go poof, and they done. So kind of know about that, and when you go to give them, make sure if they have these inhalations or these hydrocarbons, it can kill them instantly. So look, we all learned something tonight. All right, so now let's get into some fun and serious stuff. Um, hydro Hydrogen sulfide. So hydrogen, it's a highly toxic, colorless, and flammable gas with a distinctive rotten egg odor. Somebody tell me what the hydrogen sulfide is. It's got that smell. What do y'all automatically resort that back to? Yeah, Victoria gas, but not like ethanol or bodily produced gas or naturally gas or what you mean by that? Can't just encompass it all. All right, nobody wants to chat, so I'll keep going. Ha. So it's natural gas. So that's the reason why the smell has been put in there. So that smell of rotten eggs, ow, changing positions in my chair, it hurts. So it's an ingested, it's an odor that's put into natural gas. Poisoning usually occurs by an inhalation. Hydrogen sulfide affects all organs, but it has the most impact on the lungs and CNS. Used to commit suicide refers to as a chemical or detergent suicide, and that's where you may see like a natural gas container in a vehicle, and they've opened it real quick, and they shut the doors, and they leave a note on there: "Don't open door. Hydrogen sulfide inside the vehicle." Well, if you don't know what hydrogen sulfide is, and you open the door, like, boop, you're next. So if you right there, if you approach an enclosed vehicle with an unconscious patient inside, be alert for the warning signs as well as containers, buckets, or pots. If you suspect the presence of a toxic gas, wait for a hazmat until the scene is safe. I would if you think you're going to an exposure, just request them anyway. And once they tell you it's safe, you still walk up in there and be like, I don't know what's going on. Let me see. Let me check for myself. So signs and symptoms of earliness, late obviously is death, but nausea, vomiting, they're confused, they have dyspnea, hey, and I can't talk, and loss of consciousness, seizures, shock, coma, cardiopulmonary arrest. Duh, we know that. Once the patient has been deconned, I'm not really sure if they're going to be deconned because it's a gas. It's going to vaporize after a while. So I'll have to Google that one. Monitor and assist the patient's respiratory and cardiovascular functions, and transport. And again, we're going to provide high flow O2, get them into clean air, remove them from the environment. If you feel it's appropriate and you're comfortable with, remove their clothing, leave their undergarments in place because there's no reason why you need to expose their underneath their undergarments unless they've been contaminated by that particular substance. Leave it in place, cover them up. It's less you got to worry about. Police may want their clothing anyway. And if you ever cut clothing, please, 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 always cut in the seams of clothing, not straight through the middle of the bullet hole. That helps law enforcement out. That's very important. So here's some sympathometics, are stimulants that mimic the effects of a fight or flight nervous system. Um, all right, so we're going to take an atom and a molly. I don't know what molly is. I didn't know what atom was. It's MDA also. So you can see they have different names. I'm sure there's so many other different names for these that I don't really know. I mean, I'm not that kind of, I don't go down that route. But there's just what your book's telling you on 21.4. Uh, some more about the symptomatics. These are frequently hypertensive, tachycardia, and dilated pupils. So you may get a call for their chest is pumping out of, I mean, they feel like their heart's going to pump out their chest. Um, Maybe once you get there and their blood pressure's through the roof and they're super sick from it, that's another issue. Some of the examples: amphetamines, methamphetamines, amphetamine sulfate, designer drugs such as MDA, ecstasy, or Molly are frequently abused in certain areas of the United States. I see they're having a huge issue with Molly in the UK. Like they have like these Molly raves. I like to watch the drug wars or cartels thing. That's kind of my show. Um, but like the UK is like flooded with MDA, liquid MDA, and all this crazy stuff. It's just like, wow, man. If I had a different career path, I'd move to the UK. No, I'm just kidding. I'm just joking. Commonly take my mouth. They are also injected by drug abusers. Obviously, a lot of things that gets in there faster they want to inject. So look for needles. Be careful. Don't pat the pocket down because you may get your finger stuck by something, and then now you become a patient. Cocaine is maybe used in different ways. Absorbed through the mucous membrane, so they'll rub it on the inside of their mouth. They'll snort it. They'll inject it. They smoke it. I think it can go every single way. Inhalation, ingestion, absorption, and injection. Yeah, there we go. So it's all covered underneath one. An acute overdose is an emergency. A lot of times you will not. Let me say this. You may see an acute overdose of cocaine. Um, Most of the time, they don't because of the substance and or particular quantity, and they try to take care of it and treat it themselves. But you may start seeing a chronic overdose. So they're all going to have parts for seizures, cardiac dysrhythmias, and a stroke. Um, if you see those in early stages, you may ask, was there any recreational drugs? Now, I like to say, hey, look, man, I don't give two rats ass what drug you've used, but I can give certain medicines and I can't give certain medicines depending on what drug you use. If you'll just let me know so I don't give you the wrong drug. And then I tell them when I start the IV, I'm like, okay, so this flush, this is the good drug. So this is not gonna kill you like this other one. I'll grab another flush. It's one is to help me with my report, and if I can give a different medication, yes. But that's just me, so I can figure things out. So patients may be experiencing hallucinations or paranoia, placing you at risk. So keep your distance, keep your hands ready, protect yourself. Um, If you have the ability, some agencies may use law enforcement to help restrain them. Some may not. And transport them to the ED, obviously, on supplemental oxygen, um, and provide suctioning as long as you need it. Um, Systemic. So we'll go just cover. We only got 2 slides of this bath salts. So the worst, the second worst fight I've ever been in was a dude on bath salts. There was 8 of us officers, and we kind of all lost. We kind of stepped back and regrouped, and we're like, okay, we can do this. We're gonna take care of this. But the bath salts, I don't know if they're as much around as they were in the past. I don't know if they've kind of fixed those things, but the bath salts are still they are around pretty heavy. Um, they sold bath salts to escape legal restrictions imposed on illicit drugs. Some of the brand names, let's see, is called Ivy Wave or Cloud Nine. Uh, it does produce euphoria and increase mental clarity and sexual arousal. I don't know, not gonna do that. Most users of this drug snort are, and oh no, I'm not snorting nothing. Effects reported last up to 48 hours. Well, I guess they got their money out of it. So, um, be cautious. Bath salts are very, 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 very dangerous. And that's the reason why I encourage everybody to use your caution anytime you're messing with somebody that's on a drug, because of it's gonna potentially hurt you. I thought I saw somebody post on the Facebook page. That's what I was double checking. Okay. Let's see. Next. All right. I have specifically seen the teeth grinding. It sounds like rubber. They're going high. So if you take your shoe and you rub it on the floor, it's like it sounds just like that. They grind their teeth so hard that it's like you don't even hear the teeth of the enamel grinding. It's so like whoa. The muscle twitching, y'all have seen that on some of your heavy drug users. I know you have, or just walking through public, and you're like, "What's wrong with that dude? What's he keep smacking his lips for?" That's just signs of bath salts. Confusion, gastrointestinal conditions, paranoia, headaches. Everybody that's on bath salts always worried that somebody's in the bushes coming to get them, and that they're hallucinating that the green men in the front yard are coming after them. Don't play into their games, but just know that they see all sorts of shit out there, and they're going to continue to see it, and it's going to be a fight on your hands. I promise you. You need, if you can calm the patient down, good luck, good luck, good luck at that. But you're going to need lots of hands, PD, fire. Uh, I don't know. I call it like the elephant teams to set the elephant and sit on them and hold them down because they're going to go nuts. They act like zombies. Sometimes they've been shot multiple times. Y'all see in reports that they just don't stop. And it's bath salts. Always consider ALS because my joke is if I can hand them off to somebody else, better off I am. Because you may need to chemically restrain this person is the reason why I'm saying ultimately for ALS provider to show up. Because if they can sedate them with heavy dosages, then that may be the way that we can transport them safely to the hospital. I see it's 8 o'clock. Does anybody have any questions so far? I hope I've answered your questions if we've gone through the class and the slides, and I see them pop up on the bottom down there. But we'll take a 10-minute break. If nobody has any questions, I'll see y'all at 10 after 8. All right, got our 10 minutes. Got a little bit of sugar in me, and we're good to go. All right, so here we are. All right, so marijuana. I don't know anybody out of 16 people that's here that probably have never been around marijuana. That's just me personally. But they say it's the number one most abused drug throughout the world. I'm just going to tell you what the book says. How about that? So nearly half of Americans have all tried a marijuana. Uh, the THC is the chemical in the marijuana plant that produces its high. Inhaling marijuana smoke produces euphoria, relaxation, and drowsiness. It impairs short-term memory and the capacity to do complex thinking and work. Right? The euphoria could progress to depression and confusion. I think that's individually there. Okay. With high doses, patients may experience hallucinogens, are very anxious or paranoid. Now, I'm gonna more towards there. That is, if something's added to the weed, um, if if you have a chemical agent that's been added to it to extend the high or uh, the way it's grown, I mean, I can get that. Yeah. Reassure the patient and transport minimum amount of excitement. Marijuana is often used as a vehicle to get other drugs into the body. I've heard that for many, many years. But again, my question is, well, okay, so what's alcohol? I mean, I know people that drink on a regular basis that aren't alcoholics, and they've never tried anything else. So I like to argue with that. Uh, Several states have now legalized it. We know marijuana is medical use also. Edibles or baked goods, candies, and other food additives that have been infused with marijuana. They have a marijuana cook show on Vibe TV that I love to watch. That it just blows my mind that they cook everything with at least THC and CBD in it. Um, Ingestion can lead to cannabinoid hyperemesis syndrome, characterized by chronic marijuana use and extreme nausea and vomiting that is relieved only by a hot shower or bath. It's opening the pores, letting it out. It's kind of like you take that hot bath after uh, smoking dope. They say it'll clean you out. Sure, I don't know. It's still in your system though. Synthetic marijuana or spice, we've heard about that. It's made a big uptick in a part across the country before. It's a variety of herbal incense or smoke blends that resembles THC and produces a similar high, but it's chemically based and people make it so who knows what's really in there. It's complete loss of consciousness. I mean, this spice is pretty rough on folks. Here's a chart on what can cause halluc. Oh, let's see. The classic hallucinogen is the acid LSD. Abuse of PCP is relatively uncommon among Americans. I'm gonna tell you that stuff's expensive. I know PCB is very expensive. PCP is distractive and it's really synthesized by high potent. So just due to the cost is probably why it's not overly abused there. So some of these agents cause visual vis- hallucinogens, intensify vision of hearing. That's the reason why some people are like, I can smell those colors. Oh, okay, sure. Mushrooms, all those stuff causes that. Patients experiencing a bad trip, they will have hypertension, tachycardia, anxiety, and paranoia. I've been told, I don't know this, but they say it depends on your surroundings and the people you are with. So if somebody's having a bad trip, it may be due to somebody in their immediate area or what's going on at the present time for that to happen. It's hearsay. Here again, we want to use the calm, professional manner that's in our systems. We want to provide emotional support. Don't restrain them unless your patient creates danger of you. Watch the patient carefully throughout transport. Do not leave unattended, and always request ALS support when you have these. Uh, so these medications have the properties that block the parasympathetic nerve. Um, hot as a hare, blind as a bat, dry as a bone, red as a beet, and mad as a hatter. Okay. The person who has a classic picture of a person who has taken too much uh, anticholinergic medication. Okay, cool. All right, that was new for me. Common drugs includes atropine, Benadryl, Jimson weed, and amitriptyline. Okay. With the exception of Jimson weed, these medications usually are not abused drugs. You might tell me what Jimson weed is, we'll be all right. It's often difficult to distinguish between an anticholinergic overdose and symptomatic overdose. Both groups of P patients may be agitated and have tachycardia and dilated pupils. Sounds good to me. I'm gonna rock on with that one, folks. Uh, Sorry, clicked too fast on my other one. These medications. So I already read that one. Sorry, I was on the wrong slide the entire time. I'm sorry, y'all. Some tricyclic antidepressants have significant anticholinergic effects. Death from these agents can be rapid and can go from appearing normal to seizure and death within 30 minutes. Okay. The seizure is a dysrhythmic, are best treated in the hospitals. Transport immediately. Consider calling for ALS while en route. And notice how it says right there what I just said, call while en route, because you don't want to delay treatment or transportation when you realize that this is a potential issue. Go ahead and call them to intercept your route to the hospital, and they can get in the truck and go with you. Cholinergic agents. These agents overstimulate normal body functions that are controlled by a parasympathetic nerve. Okay, well, look, here we go. Includes nerve gases designed for chemical warfare. Right here. So use the mnemonic. Oh, where did it go? Poison result in. So that's your. Remember your mnemonic I was telling you to use. Here's another one that's a different one that we were going over earlier. So dumbbells is basically the same exact thing. And then you got sludgeum, which is the next one. And that's what we talked about before, is sludge. They're basically the same thing. You just notice they're in a little different order and they ask for different questions. So it may be good to learn both of them if you have a lot of chemical agents in your area. Mosquito spray, high overdose of mosquito spray can be also, and we used to run behind the mosquito trucks when they come in my neighborhood. I remember that. Ride your bike as fast as you could behind them. I guess that's why I'm ate up with mosquitoes now, because it quit working on me. Um, all right. So the most important consideration is avoid your exposure. Decon needs to take priority over immediate transport. Clean this patient, get it off of them as fast as you can. A lot of your trauma, like level 1 trauma hospitals, have these decon abilities built into their hospitals. They have certain teams that will come out. So just let them know the patient is needing decon. We will need decon support there. They may reach out to the local fire department to meet you there. So just the faster they know, the better off they are. You will notice the patient in these times that they'll start to have they'll have more and more dry mouths. I don't know if that's you're going to be inspecting their mouths all the time, but notice that if you have to, get them to stick your tongue out, and then if you notice that it's starting to get drier and drier, that's probably why, because it's starting to work on the sludgeum right there. It's starting to take it all away. And then obviously we talked about this 500 times. Provide airway support. You're going to need it. Get your stuff ready. Lay it out there. Have things on the bench, and be prepared to be aggressive when it's time to go after this airway. All right, so the antidote kit may not be available. The duodote auto injectors, they're very, 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 very expensive. This is a little bit higher than some of your snake antidote medications. I've messed with probably 4 or 5 of these. I've been to some schools that have hundreds of them, and they're very, very expensive. It's just like the regular auto injectors that you see, the epi ones that we showed before. They look the same, except they're duos. They're double needles. Um, Checking my notes to see if there's a picture of one. So they inject 2 chemicals at one time. A little tip for mosquitoes: if you will rub a plain dry shit. No, that don't work for me. Don't work. But I'll keep on reading it. Um, Not a fluorescent scent one. You're exposed to skin to mosquitoes. You'll stay away. I know Louisiana has a different type of mosquitoes. They have pterodactyls. Um, so if you know that these areas are in, if you know that these antidotes, the duodote auto injector is around the area, or you go to an area that they tell you we have the antidote on site, and you're like, oh, say what? I don't know what you're talking about. Um, if a known exposure to a nerve agent with manifestations of signs and symptoms have occurred, use the antidote kit on yourself. Use one for you and one for the patient. You're first because you're the provider. And you might want to sit down on the ground, like get on your knees, because when you hit yourself with these double doses, you have the potential ability to pass out because they hurt really bad. Just FYI, just a side note, one of those Wally-isms for y'all. All right. So miscellaneous drugs. We'll talk about this again. Accidental or intentional overdoses with cardiac medications. This is very common here. A lot of your older patients don't understand, or they'll tell their doctors that they're on one medication and not on another one because they've forgotten. And then now that they're taking all these together, you start to have an overdose. It's not done on purpose, but it is common that happens. So just the reason why we always ask for their medications and so we can work on them. Signs and symptoms depend on the like we talked. I know we said this earlier. Depends on the medication that was taken. Poison control, huge deal, and you may be ordered to administer activated charcoal. I wouldn't take the orders from poison control because that is a call center that's nationally located somewhere in the country, and your med control doctor is for your agency. I would call poison control in conjunction with med control of your area. Follow your company's policy procedures first. We talked about aspirin earlier. It does depends on the dose. It can be very lethal. Uh, Aspirin toxicity. You will start to see the nausea, vomiting, hyperventilation, and ringing of the ears, tinnitus. You'll notice those just over time. It'll build up because they're taking too much, or they may take it often. Um, and some of the patients are going to come across with anxiety, confusion, tachypnea, hypothermia, danger of having seizures. Well, it's either you are or you're not in my book on seizures, because I can treat a seizure. I can't treat the potentials of having a seizure. So, so food poisoning, we're going to talk about that in a second, Mary. I know it's in here. It's closer to the end, but we will. It's probably not going to be as deep as you want, but if you want to ask a question, and I'll try to see if I can address it, we go through here. Um, so miscellaneous overdosing. Oh, okay. Here's my notes. Overdosing with acetaminophen and medications that contain acetaminophen are also common. Among the top 25 substances, and the largest number of fatalities is due to poisoning. Overdose and unintentional and intentional must be treated promptly and aggressively. Accidental acetaminophen overdose is as serious as an intentional overdose. Uh, Patient is unaware of the continuous exposure to the toxins, and massive liver failure may not be apparent for a full week. Gathering information at the scene is very important. Some alcohols, including methyl alcohol and ethyl glycol, are even more toxic than ethyl alcohol drinking alcohol. True, because it hasn't been filtered out and broken down into where it's consumable by humans. Both will cause severe tachypnea, blindness, renal failure, and eventually death. Immediate transport to the ED department or the ED is essential. Um, so that's the reason why that the ethanol glycol and the methyl alcohol, yes, they are alcohol, but could be rubbing alcohol. People drink Dr. Tishner's and get drunk off of that because the alcohol content. They got some clean breath though. So think about that. You need to know what they were drinking. If they hand you a bottle of rubbing alcohol, know that they're suffering from late stages of alcoholism and they're probably trying to die. So just keep that in the back of your mind. All right, Mary. So food poisoning. Food poisoning is the most always caused by eating food contaminated by bacteria. There are two main types. The organism itself may cause the disease, or an organism may produce toxin that causes disease. Here are some of the organisms produced direct by foods. Salmonella bacterium. We all talked about the norovirus. We know about that. The rotavirus. Kids are very susceptible to those, so are grown adult. Staphylococcus toxin. Whew, I ain't gonna try to pronounce some of those. Y'all know me. Obviously, I can't do that. E. coli is right here. So some of these are very predominant that we're used to seeing. Some of these just may because people aren't washing the bacteria or what they wash it in may be covered in human feces. I don't know. That's gross, but just know about that. So here's some characteristics of food poisoning. You're probably going to notice it within 72 hours. Could be sooner. I've seen it as close as to 8 to 10 hours. Proper cooking is the big thing. Cook that food. Oh, it's raw, consuming raw food. You've seen that. They put all these notices out and all that stuff. Consuming raw food may be unhealthy for an individual. Yeah, I know. We all do that. But the cleanliness of a kitchen, if the kitchen is nasty, Mary says yes, and it makes your stomach hot. Oh, does it? It hurts so bad. If a kitchen's nasty, now we're not gonna know that until we walk into a facility, or unless you're eating at somebody's house, there's no way you're gonna notice that. The prep of food, I mean, there's so much there, and just because you get vomiting, abdominal pain, and diarrhea just after you eat something local, doesn't always mean that it is food poisoning. Now, if you get if multiple people get it from the same place within a couple of days, then yes, we're gonna go more towards food poisoning. But it's something. It's just you can't make people clean. I mean, if dirty people are dirty, then they just gonna be dirty. So I'm very very picky about where I eat, how I eat from places. Is local mean Taco Bell? JW, I purposely don't eat Taco Bell because of a food poisoning one time. I don't care where I'm at. I don't eat Taco Bell. Just saying. The more common cause of food poisoning, ingestion of powerful toxins produced by the bacteria. Often the leftovers. That's another thing I don't do. I don't eat leftovers. Period. I'm not doing it. My wife knows. I just throw it away. Bacterium Staphylococcus is quick growing and produces toxins in the food. Food and left in unfrigerated area are common. Oh no, nope, can't do it. Yeah, my stomach's turning thinking about that. And then right there, we talked about can start within 2 to 3 hours, is up to 8 to 12 hours after ingestion for the food poison. Now, I have eaten food with mold on it, but to the note of that, it was a cheese, but it was different. It was edible mold. It was very different. I felt like I was sick, but I really wasn't. It was good. Uh, wouldn't your dogs eat leftovers? No, but my in-laws do, so they take it, and plus they don't give enough meat. You're right. I just don't do certain places. I'm weird when it comes to eat, but I can tell you I haven't missed a meal, so I could go without losing some weight. I'd be all right. I wouldn't complain. I probably would, but I need it. Um, so the most severe form of food poisoning is botulism. The spores of Clostridium bacteria grow and produce a toxin. These symptoms of this can cause blurred vision, weakness, difficulty in speaking and breathing. Often fatal symptoms may develop within the first 24 hours after ingestion and as long up to 4 days later. Oh, wow. That sucks. Again, watch what you eat. If it don't look good from the outside, don't go and eat it. People may say that's the best food in the world. All right, well, I ain't never going to have the best food in the world. And some of your nice high dollar places you get sick from. I mean, I know that I'm just picky for that reason. Once for a local Taco Bell, it was horrible. I'm just gonna leave it like that. Um, so don't in the field, don't just break down like, oh, I think they're having this GI problem because of this, and they said that they ate at a Jack in the Box. I've never eaten a Jack in the Box, FYI. I'm just saying on this date, and I've seen on Facebook that 17 people got sick. It's not our job. Just treat their symptoms. Uh, uh, don't get wrapped in the weeds by things. Just be like, okay, they're having this and this and this and this and this symptom, and it started occurring 2 days after they ate a hamburger. All right, cool. All right, so what's going on right now? What do you want me to fix right at this moment? And treat it. That's just kind of these things. It's not your job to determine all that crap out in the field when you got a lot of other stuff going on. Because if so, we'd be sitting out in the field trying to diagnose this crap all day long. Here's some plant poisonings. I know we talked about that a little while ago. Um, I didn't know pokeweed. I know the castor bean was. Has anybody ever heard of some of these? There's the Jemison or stinkweed. Oh, Robin, don't say that. That is, oh, I just go for the margarita. Jeezers. Taco Bell in San Francisco is better. You can get a margarita too. Um, I've never heard of some of these plants. I know that some of these are in your home, but I've never heard of them. So I can't really give y'all some explanation because I'm not the kind of plant guy. Um, you're you're not gonna memorize every plant out there. Even wildlife and fisheries of each state, they know a lot of it. But JW, can you tell me what angel trumpets? What are they? I mean, I know obviously it's a plant, but um, so on this right here, just notify that there may be a poisoning in the area, that they may have something that they've been exposed to, and they've been been poisoned by a particular plant. Here's some pictures. I don't know what any of these are. Oh, so it's a flower they brew in tea. All right. See, I learned something today. So, all right. So this one is a mistletoe. The castor bean. This is nightshade. No, that can't be because there's not enough. That's mistletoe. Sorry. Castor bean, nightshade, foxglove, and that's a heck of a name right there. So I don't know what neither one of these two are. Sorry, I'm using the wrong mouse. I don't know what these two are. That's your mistletoe, castor bean, nightshade, foxglove, and this one and that one right there. I can't pronounce those. They're like 17 syllables long. Let's see what these are. This right here is Jimson weed. I guess that's what's popular. This one is Death Camus. Oh, they say that's poison ivy, but um, it looks different in mine. Travis, which one do I need to stay on this screen or go back to another one? That looks like a dead bat, in my opinion. All right, Travis, I'm gonna go back. Is that better for you? Travis, let me know when you're done, and I'll go back. All right. Yeah, that's it's not what it said, but I don't know about that, Travis. I don't know my plants. You notice a lot of these are wildlife and fisheries, and some of your botanists and stuff like that. So plant poisonings. A lot of this goes off poison ivy. I don't know if anybody's allergic to poison ivy, but you'll get the irritation of the skin. Whelps will happen up. Uh, oh, I like this one. When chewed, a single leaf may irritate the lining of the upper airway enough to cause difficulty swallowing, breathing, and speaking. Well, I'm not sure I'm just going to swallow some random plant. So I'm anyway. But we're just going to maintain the airway like we always do. We're going to give oxygen and transport to probably a trauma center that has a poison control specialist. So here's your poison control number. So if you dial poison control, just FYI, even though if you tell them your provider. Oh, let's see how I put it. I was on the phone for an hour and 10 minutes the first time, and then they called me back in 3 hours to check to see how I was doing. Ma'am, I'm the paramedic. It's 1-800-222-120-1222. They I was wondering about that, JW. You got me for a second. I was like, one. So, fair warning, they're gonna call you back. So if you really want to get somebody, call them at the end of the shift and from your partner's phone. They'll call them back 3 hours later. But be prepared to ask and give a lot of questions because they will ask you a lot of questions. That's kind of that's their thing. They like to know and they want to know a lot of information. Does anybody have any questions on what we've talked about that so far? Does anybody have anything y'all want to add about poison control, poisons, toxins, anything like that? It'd be helpful. Some of the things that y'all talk about could be very helpful to us. Um, it's could be very beneficial to all of us to hear a couple of things that you guys may have. Um, I Give me 1 second, real quick. All right, hold on a second. All right, guys. So I am. Do we always have to call poison control on every port? No, you don't. But I would specifically let your med control know that I would call them first and let them handle that and say, hey, look, I have not spoke with poison control yet. Would you like me to call poison control and or transport? You don't have to call them. You don't. It's a personal thing. So that's completely up to you on what you want to do there. So guys, look, Victoria helped me out there. That's the code. I can't type in the chat box for some odd reason, but your class code is capital C O capital V 2189. Capital C O capital V 2189. I don't know why it does not let me text or type in the chat box, so I had to get Miss Victoria to help me out. Guys, if y'all don't have any questions, I know it's 8:40. I think we covered a lot tonight. Um, I'm tired too. So if that's it, guys, I'm gonna let y'all roll for the evening. Thank y'all so much for joining me. Please let me know if y'all have any questions, concerns, or problems, and I will do whatever I can to help you guys out. Um, if not, y'all have a wonderful evening, and I will see y'all Thursday night. Let me know if I'll be in here for a few more minutes if y'all have any questions.